If you've been through this or you're supporting someone who has, you know how frustrating it is when the picture doesn't match the standard story. The same black-leg tick that carries Borrelia often carries other pathogens at the same time. These are called co-infections. And recent studies suggest they can show up in a significant portion of cases, sometimes up to 40% in certain regions for the most common ones. But let's walk through the main ones that you're likely to hear about, some of the co-infections. The first one is Babesia, and this is a malaria-like parasite. Okay, this is why when you come to a holistic practitioner that does a lot of parasite work, I also do a lot of Lyme work because parasites are delivered with Lyme in many cases. Babesia, it's a malaria-like parasite that infects your red blood cells. Common symptoms include drenching night sweats, air hunger, feeling like you can't catch your breath even when oxygen levels are normal. Okay? Cycling fevers or chills, and profound fatigue that feels worse than typical Lyme exhaustion. Standard Lyme antibiotics don't touch Babesia, so it can linger and make everything feel heavier because they give you an antibiotic, and antibiotics don't typically kill the parasites. See the difference there? That's why they're missing the mark. Another co-infection is called Bartonella. And this is often called cat scratch disease bacteria, but ticks can transmit it too. It can bring migrating joint and muscle pain, severe headaches, neurological symptoms, swollen lymph nodes, you might feel them in your neck too, and even psychiatric type issues like irritability, anxiety, or rage episodes in some people. You can get stretch mark like rashes that sometimes appear. Another co-infection is Anaplasma or Ehrlichia. And these bacterial infections often cause high fever, headache, muscle aches, and fatigue that comes on fast. They can affect blood counts. You can have low white cells or platelets. And while some antibiotics used for Lyme also cover these, the symptoms can overlap and complicate the picture. Studies show that when co-infections are present, people sometimes experience more symptoms, longer lasting illness, or a tougher recovery.